neurogenetic disorders. And I would like to thank the conference for uh, this event from organizers for this opportunity. And I would like also to thank all of you to join this virtual poster session. Well, in my presentation, I will follow a simple structure, clear, understandable, starting from why these disease matters and the some of the points about the neurodegenerative and neurogenetic disorders, and a brief clinical overview of the main diseases in our study, and what are the gene therapies that I used here, and why we studied the adeno-associated virus type 9, AAV9, on the lipid nano particle LMP vectors. And I will mention also the methods of our translation study and the result, including the neuronal transduction, gene expression, stability, and also the clinical outcomes that we get from this study. Also, safety profile and adverse events discussion, limitation, and the future decision about this study, and also some of the final conclusion about what we will be talking about. So, why this topic matter? I mean, the topic that you just in front of you, the neurodegenerative and neurogenetic disorders are a major global health problem, and we see they affect millions of people worldwide, and often leads to some of the symptoms that can cause loss of independence, progressive disability, emotional, and even the financial burden of many families and the reduced life quality. So the examples that I just included here include the amyotrophic lateral sclerosis, which is a motor neuron disease that leads to muscle weakness and paralysis, and even the respiratory failure. I also included here the spinal muscular atrophy, genetic motor neuron disease that leading to muscle atrophy, especially in the children, and also the PD, characterized by body kinesia, rigidity, tumors, and gain disturbance. Why the neuronal targeting is so challenging? Because that the neurons are protected by the BPP, and they have a complex morphology and distribution. So to reach and transduce them effectively, victors need to either bruise that barrier or to be delivered to the target way. Achieving sufficient concentration in the right region without causing damage is the major challenge in the neurotherapeutics. So starting from the well, before we going deeper, let's briefly define two keys terms here. The neurodegenerative disorders, these are a condition where neurons gradually become dysfunctional and die. For example, we can see it with the amyotrophic, as I said, lateral sclerosis, or even Parkinson's disease. We can see it with, and the pathogenesis often involve protein misfolding and mitochondrial dysfunction, oxidative stress, and abnormal aggregation as well. And the neurogenetic disorders, these are neurological disease caused primarily by genetic mutation, such as spinal motor atrophy and certain monogenic epilepsies as well. So here, the cause is directly related to a specific gene defect. In both the groups that I just mentioned, there are strong rationale for gene-based therapies, either by replacing a missing gene, silence a toxic gene, or even like by correcting the dysfunctional pathway. So, brief clinical overview of the main diseases that I just mentioned. The first one is the amyotrophic lateral sclerosis. Uh, and there's the motor neurons in the cortex, brainstem, and even the spinal cord progressively degenerate. So the patient come with muscle weakness, uh, fasciculations, spasticity, hyperreflexia, and so on. And even in Parkinson's disease, because it's also a result of dysfunctional protein synthesis and that stuff. Well, it's a neurodegenerative disorder, primarily involve the dopaminergic neurons and the substantia nigra. It comes with a rigidity, postural instability, and the bradykinesia as well, resting tumors. So we know that there is many medication such as levodopa help to reduce the dopamine but over time patient develop motor fluctuation and dyskinesia. And here we come to the gene therapy in the Parkinson's disease that aims to enhance dopamine synthesis and protect the dopaminergic neurons from degeneration. Same thing with the spinal muscular atrophy, which is also genetic motor disease, most commonly due to the loss of SMN1 gene that leads to deficiency of the survival motor neurons, which is a protein. And also we can include genetic epilepsy, because after this study, we will figure out or see that all of the diseases that I just mentioned are really get corrected somehow by the gene therapy I will talk about. So what is the gene therapy that I am talking about? It's just a technique where we deliver genetic materials into a patient cells, especially like a neural related one. For what? To replace defective or missing gene, to silence a harmful gene, or to, introduce a new gene with a therapeutic function or, aims. Um, so to do that, we need a vehicle, which is vector, to carry genetic materials into those cells, which is far away somehow. And that brings us to our two main delivery systems that I mentioned in this study. The first one, AAV9, which is the adeno-associated virus type 9. And the second one is the leptin nanoparticle vectors, LNP. Why this one? Because, for example, for AAV9, I'm still in the introduction, by the way. It's a small, non-pathogenic virus that has been, engineered to be safe as a carrier. So it serves some of the advantages. For example, it can cross the BBB. It shows strong tropism for neurons, especially the motor neurons, and also it maintains the long-term gene expression. It good ones for the degenerated genes. By that, we can synthesize some of the missed protein there. And also, it has relatively low immunogenicity, because we will see this is a virus, but not pathogenic. So we need to be aware about it, whether if you introduce or insert such that viruses particles in the body targeting the cells, well, that may to induce the immunogenicity or immune system, and you can get a reversed effect, side effects. So why we select AAV9 instead of other AAV9, like 2, 3, AAV3, many ones, but this one is has a unique profile. It crosses the blood-brain barrier, and it has a stronger tropism for motor neurons and other neurological evolution compared with many other subtypes. So it can cause kind of low adverse effect, and it can't really induce the immune system when we insert it in simple term. And what about the lipid nanoparticle vector? It's a non-viral carriers compared to the other, composed or contain a lipid, which is encapsulate genetic material, and it's also often like messenger mRNA or small interfering some of the like siRNA. So, well, generally the LNP become globally famous, as we see with the COVID-19 mRNA vaccine has really advantageous stuff. They are non-viral. They avoid some of the viral vector related immune reaction, and they can carry large genetic payloads compared with any viral vectors except the first one, AAV9. And we will see that the effectiveness and the good result will come with the first one, not this one. Because, okay, it can carry large genetic payloads compared to other viruses, but the issue is about the quantity, not the quantity, not the quality, not the quantity. And they can also be produced at a scale and modified chemically. So in this background, I just would like to briefly explain why why these diseases and gene therapy are important. For example, amyotrophic lateral sclerosis and even the Parkinson's disease are, condition in which the neurons gradually become dysfunctional and die. So we just need a way to even get it back or to fix the dysfunctional that happens over there. So most of our current treatment, as I said, is just symptomatic. We just need to, reduce the tumors, improve movement, slow progression slightly. But we really need to, in medicine, for example, as a medical intern, when we face a disease or disorder, we really look for, fix the main issue, the causative agent. So we see that the symptomatic management, it's general, but we need specific things to reduce the harmness of these dysfunctional that lead push the patient to get some of such those diseases. So the objective, as you see here, with the background that I said, we need just to evaluate the safety, efficacy, and durability of novel gene therapy vectors, which targeting the motor neurons and dopaminergic pathways in patients with a neurodegenerative or, the neuro genetic disorders. So we just specifically compared AAV9 with the LPD. And if we look here at the background, as I mentioned there, and let's move to the methods, as I already done with the background. So the method here is, this was a translational study, meaning we integrated preclinical data with the early phase clinical data. Participant was around 100 participant, which is diagnosed with ALS or amyotrophic lateral sclerosis, some of them genetic epilepsy, others Parkinson's disease. So the participants were carefully selected based on, diagnostic criteria of each disease, clinical stability, durability of the gene therapy, and so on. So the intervention here is that we compare two gene delivery system, AAV9 based vector and the LNP mediated vectors. The therapeutic construct was designed to target the neuron and dopaminergic pathways, aiming to restore the functional proteins and protect the neurons as well. So the outcome measures we evaluate is the neural typism, how well each vector target the neurons, the first one will win. And the gene expression level, like intensity of the expression. And the expression stability over time, how long expression persists. Biomarker normalization, change in the laboratory markers, it's really important to not only follow up, but to see the progression of the disease over there related to the inflammation and the neural injury. Clinical improvement scores by using some of the standardized motor skills and functional assessments and functional domains, especially fine tumors control and speech and that stuff. Well, I didn't mention here, but of course, about the ethical consideration, the study was followed ethical guidelines. Informed consent was obtained. Participants were closely monitored throughout the follow-up period. So the mechanism diagram that which is here, how the vector work here. The method is so just to zoom it out. So So on the diagram in the presentation of parser you see here is you can see a simplified illustration of the delivery mechanism. The AAV9, this one, and or even the next one is the lipid nanoparticle vector is administered typically by systemically or targeted routes. And then the vector will cross the blood-brain barrier, BBB, targeted the CNS or bypass the blood-brain barrier and reach the neurons which is our target. So inside the neurons, the vector delivers its genetic payloads that we talked about. The whole machinery then expresses the therapeutic gene, producing the missing or corrected protein, which is our goal here. So all of this will lead to improved neural survival, reduces the neural inflammation, improves synaptic function, and clinically improvement in symptoms. These diseases of the four ones that I mentioned, and even some of other diseases I didn't mention, but it really show significantly that result with these specifically diseases. So if we move to the result here, we will find out that the AAV9 vectors achieved higher neural transduction with about 91 of the target neurons successfully transduced. Whether LNP vectors achieved about 63 percentile neuronal transduction. So there is a substantial differences and clearly favor AAV9 in terms of the efficacy and the delivery into the neurons. Well, of course, for a reason. So AAV9 or adeno-associated virus type 9 maintained stable gene expression for at least 20 weeks or more with a minimal decline after 5 months. Is one. But in contrast, the gene expression with the LNP lipid nanoparticles showed a shorter duration and more noticeable decline over time for a reason. So the question comes, why was expression from LNP less durable? Well, the lipid nanoparticles vectors often deliver mRNA or similar, constructs, which are intrinsically transient. In addition, that LNP are more rapidly cleared or degraded in vivo. This combination leads to shorter duration of the expression compared with the adeno-associated virus type 9, which can persist in cells for longer periods. So we can see here who wins. So, but Does that mean that LNP is a really bad and can't be used anymore? At all. Lipid nanoparticle systems will still have significant advantage, especially as a non-viral platform. As I said, it can also carry a large amount of aimed substances that we used here to correct, fix, regenesis of a neurons that we missed, or even correct the degenerative neurons. Well, all of that compared to the adeno-associated virus type 9, which show a really better result. So with a further chemical and structural optimization, LNP may become more competitive for neurological application. Well, both of them is still used, and it shows some of good result in that aspect. So, summaries. This suggests that AAV9 vectors are more durable for long-term expression in terms of treatment, the dysfunction, degenerative diseases related to the nervous system. So the result, as you see here on the chart and the figures, that clinically we observed meaningful improvement in several disease group. Like if you see here that in the first one in ALS or amyotrophic lateral sclerosis, like around 65 of patients demonstrated clinical improvement. Moving to the next one, like 75%, which is Parkinson's disease, around 75% showed improvement. And as well, the spinal muscular atrophy, good. The improvement rate reached approximately 95, 85%. So this improvement, as we see here, were documented using standardized clinical skills and also were reflected in a patient reported outcomes, such as better performance and activities of the daily living. So it's covered by a good way to show that result. So the patient here showed uh, gains in fine motor control. If we're talking about specifically Parkinson's disease, speech metrics, and even the mobility posture in some cases. So as you see here, the bar chart and the poster visually present these percentage for the ALS, Parkinson's disease, and even the SMA. So the line graph in the poster compared AAV9 to the LNP. Clearly visible here, and we see that the AAV9, this chart, which is the longitudinal gene expression stability, AAV9 shows a high and stable level of the gene expression across the observation period, with only a mild downward slope after 5 months. In contrast, LMP shows a more pronounced decline, reflecting the shorter duration of the effective expression. About the discussion, what do these results mean? Taken together, our findings show that gene therapy is clinically viable for the neurodegenerative and neurogenetic disorders. Second, AAV9 vector provides higher neuronal transduction, more durable gene expression, stronger clinical improvement, as we see on both of the chart there. And whether the LNP vectors are promising, well, I didn't do a great job there, but it still works and can come with a good result. But as we see here, the AAV9 is better than that term. Well, the limitation here, we need, to study something Okay, you provide the participants, you try to use some of the criteria and other stuff to evaluate the outcomes, the result, even the methods. Still, there is a limitation. So maybe like the sample size also reasonable at 110 participants. It is still relatively modest. So larger multi-center trial would be valuable actually. Disease severity and previous treatment varied among the patient, which can influence the outcomes. So we somehow can we say we can say that's a semi-accurate result comes with those gene therapies that we use there. And may some of the data are from the early onset clinical studies, whether some of them come with the late ones. So somehow we can predict and see the main point is to see which one is doing better than the another one. So we just pick up the good one. Well, with fixation of those limitation, we may come with an accurate result, which is near to the result that we got here. So I need to, I'm like, it's already done almost, but I need to give some of the take home message to summarize my main message here. Just an overview or summarization. The gene therapy has moved from the theory to clinical reality in the neurological diseases. And the AAV9 vectors are currently leading to the failure to the high neural transduction and durable gene expression. So in our translational study of 110 participants with amyotrophic lateral sclerosis, Parkinson's disease, and even the spinal muscular atrophy, and the genetic epilepsies as well, we observed a significant clinical improvement and mostly mild adverse events, which of course will be mildest in the future by developing such dose gene therapy to target such neurodegenerative diseases, etc. Mention about the note about the lipid nanoparticle vectors are promising and may benefit from further optimization. And the further work should focus, on the targeting immune modulation and advancing gene therapy into personalized neurology. So overall, our findings support gene therapy as a clinical viable and durable modality, especially with the AAV9. And that's about my presentation. And I would really like to express my gratitude to those patients and families who participated in this study, and also for the conference or the event. Sorry, organizers for this opportunity to share it with and to really